It's always been a challenge in healthcare to motivate patients to schedule their annual wellness visits and routine screenings. COVID-19 has only worsened the problem with reports of people delaying such services at high rates. A strategic approach that takes into account convenience and access is now more vital than ever in order to encourage patients to prioritize their health. Our premier sponsor, Let's Get Checked, has assembled a panel of experts to help you understand how to break down the barriers that prevent patients from engaging in preventative services and gain insight into how technology can be used to encourage patients to seek care. Please welcome Derek Newell, president of Let's Get Checked, who will be the moderator of the session and will kick us off.
Thank you. Thanks for the introduction. I'm here today with our distinguished panelist, Dr. Scott Cherry, who's the Chief Medical Officer of Axiom Medical, and Kimberly Vandervoorn, who's a Vice President at United Health Group Optum Care Solutions. Thanks for joining us. So I want to set the stage a little bit around COVID and what's been happening for the past year. As many of you know, and as being healthcare providers, diagnostics are crucial to healthcare, with 70% of medical decisions based off diagnostic results. And engagement has always been a problem, in particular around preventative health. I was talking to a friend of mine recently who works in a virtual medical practice, and he was lamenting that when he prescribed a test or ordered a test through a virtual care platform, less than 25% of the people were following up and actually getting that test in today's world. And according to a study by the Partnership for Prevention, 50% of patients in a pre-COVID world are not up to date with their colorectal cancer screenings. And we know that less than, somewhere between 40% and 70% of people are up to date with the screenings that they should have. And COVID has only made things worse. So according to a recent study published in JAMA, 58% of those that needed care skipped care. They skipped an annual preventative care visit, or they skipped needed preventative care during COVID. And so that's 58% of people who are skipping care. That is a ticking time bomb that all of us are going to have to deal with down the road as providers and leaders in healthcare. And so I wanted to talk today a little bit about engaging patients in preventative health in a world where things have moved primarily to a virtual world. We'll talk at the end a little bit about how we see the future happening in terms of what might happen post-COVID with virtual care and how that will unfold. So I'd like to start with one question, as I'd love to hear from our panelists from their unique point of view. What consumer trends are you seeing emerging within your population and industries coming out of COVID? And I'll start with Scott, if you could go first.
Yeah, and thanks for those remarks too, Derek, about your conversation with your friend on the lack of compliance to physician treatments. I actually share that frequently with business leaders, that even in a traditional medical practice, compliance to other kind of in the traditional delivery of medicine, you might see as low as 50 or 60%, because there's a lot of barriers still to committing to those types of treatments. So it is very common, and it looks like in this telemedicine practice that there's even another level of magnitude of challenges. COVID has really changed the practice at Axiom Medical. We're a population health company focusing on large employee health populations. We cover about 1.5 million lives in the critical infrastructure realm. And so our clients' employees had to keep working during this pandemic. And so we had to be very nimble in supporting them to stay at work, deciding who is safe to be at work, who should be social isolating, and when should they be returning. Early on there wasn't testing, and so we had to use really what we call a syndromic surveillance protocol, which is really just screening for symptoms. But once testing became available, that was really a great tool to determine when people could return to work or stay at work. The problem is, someone who had any type of symptoms, there was no medical facility, lab wanting to see them. And so once at-home testing was available, it was a total game changer for our clients to be able to get tested from the safety of their home and then have those results within just a few days. And so, again, I think COVID is really changing the landscape by which how we practice medicine at the individual and population health level. We know that for COVID specifically, there's vulnerable populations. And so for a lot of our clients, corporate wellness kind of has come in and out of fashion based on kind of an indeterminate ROI on those investment dollars. But because of the vulnerable populations for COVID, our clients can actually get insight into where they should actually spend their healthcare resource money if they do appropriate preventive screening through at-home testing as well. And so again, if people go see their doctor, there's less than a 50% chance of potentially getting tested. But doing at-home testing is really a game changer with regard to kind of the most common chronic medical conditions like diabetes and obesity.
Kimberly, you want to follow up on that?
Yeah, sure. Thanks, Derek. So I work with population health in the hospitality industry. So that comprises eating and drinking places, lodging, and it's about a 20 million person industry. And it's a very, very unique when it comes to health and wellness. It's an industry, people who work in that industry typically, historically, have had very, very little access to health benefits, very little access to health and wellness resources. We talk about overall compliance of the population. This population has significantly lower compliance and gets tested even less because of, well, I'm sure I'll have a chance to talk more about this over the next few minutes, but they don't have the resources. And so they haven't been a compliant population that has paid a lot of attention to their health and wellness, simply because they don't have access. So, but interestingly enough, the biggest trend I'm seeing now with the hospitality industry is, of course, the industry was absolutely devastated by COVID-19 in terms of businesses going out of business, trying to reopen, closing, reopening, furloughs, just a horribly devastating time. Now, coming out of COVID, so many of the hospitality businesses are back in business, and full of customers, full of patrons. And the most crippling aspect right now of their comeback is the labor shortage. And so, interestingly enough, what they're doing, what so many hospitalities, hotels, restaurants, et cetera, are doing to incentivize people to come back to work is using health and wellness solutions like Let's Get Checked, like telehealth, other things, health insurance, things like that. Whereas before, employers would not offer things like that to employees. Now they're doing everything they possibly can to incentivize people to come back. And so I'm seeing that as a very interesting development when it comes to digital, convenient, accessible, personal health and wellness solutions like at-home testing.
Well, that's interesting because those, once a benefit comes into place, it's really hard to take it away. So if that expands the number of people that are covered, that will be great. I think what we found is, obviously the explosion in virtual health has increased the barriers to following up on the care that's recommended from your doctor, right? Because if you're in many doctors' offices, it's like go down the hall and get your blood test done or go to the next building. It can be pretty convenient in some delivery systems, I guess less so in others. But, according to the U.S. Department of Health and Human Services, Medicare telehealth visits, which were severely limited before the pandemic and only represented 0.1% of visits pre-COVID. Post-COVID, they represent 45 to 50% of all visits. All primary care visits are happening via telemedicine. And so this drop-off following up on preventative care, especially in populations that might not be predisposed to it, like restaurant workers and other folks that in certain populations that maybe haven't traditionally had as much access to healthcare, is something that will be interesting to watch. I'm curious about, Kimberly, how do physicians and employers increase access and compliance with testing and care? And you're seeing a transformation in your industry, so maybe talk about how that might influence the future.
With hospitality, there have been so many barriers to getting diagnostics. And And when you think about people who have health insurance and who have access, and how, I mean, I'm the whiniest person in the world when it comes to going and getting a lab test. You know, I have to go get one. I put it off for 8 months. Imagine somebody without health benefits who has to go to a primary care doctor, get a script, then go to a lab, get that done, pay for it all out of pocket. So the barriers have been huge. Again, most people in hospitality don't have access to health benefits. A lot of hospitality employers can't afford to offer employer-sponsored health benefits. And then the reality is that the vast majority of people who work in hospitality are part-time, and you can't have access. You can't participate in an employer-sponsored health benefits plan if you're part-time. So no one is going out and going to a doctor, getting a script, going to a lab. Hospitality workers have odd schedules. They have odd shifts. They're unpredictable. They don't have paid time off. They can't leave the workplace. If they leave, they don't get paid. They can't put food on the table. There's so many barriers to getting tests, and the whole concept that lab testing can come to them, either directly to them or through their employer, is game changing. Is absolutely. I mean, when you speak about 70% of all medical decisions are based on diagnostics, that is, and that 80. I heard from one of my friends at Let's Get Checked. 80% of the diagnostic tests that should have happened last year did not happen last year. So, do the math and increase it exponentially with hospitality. And people need to get tested. And in order for them to be healthy medically, physically, mentally, et cetera. And so the idea that lab tests can come to them and they don't have to go to crowded offices and they don't have to take time off from work, that's a game changer. And getting it to them through their employers with my population, with the hospitality industry, is the way to do it. So I'm training, I work with associations. I'm training the associations, I'm training the employers. I'm making these diagnostic tests available to these employers so that they buy in, make them available to their employees. And, it's a game changer. It's a game changer in terms of population health, where people start getting those baseline tests and more, not just baseline, but other tests that they truly need to get healthy and maintain their health.
Yeah, we've worked with some of your clients on COVID screening, which was an exciting thing, but we see a lot of interest on moving beyond that into other types of screening and just making tests available. And I'm excited to hear that, as part of the labor shortage, there's never good things that come out of labor shortage. When people get access to health benefits that didn't have access to it before, maybe that's a great. To me, that's a good outcome. That's a move in the right direction.
Agreed.
You want to talk a little bit about how physicians and employers are increasing access and compliance with testing in your environment and what you're seeing at Axiom?
Sure. In a lot of ways, we try to create what I call a win-win-win, where we're getting the proper screening to our clients' employees, which provides individual value based on their personal health needs. But also it's a win for the employer, where if you do an analysis in most businesses, their healthcare spend is usually in the top 5, but usually in the top 3 of their business expenses. And so the outcomes may actually be mediocre if it's kind of standardized to kind of the typical outcomes we see in the current trends. And so if we can get the right screening to the employees in a very patient-centered, customer service focused, effective manner through screening, potentially at work, through kind of a modality we call Know Your Numbers, where the American Heart Association shows tremendous value in just understanding just a few key metrics. For instance, your fasting blood sugar, which would be indicative of diabetes. Get some blood pressure screening, whether it's an at-home blood pressure machine, just a simple scale for your weight and, a ruler or a measuring tape for your abdominal girth. Also do some additional testing, what we call hemoglobin A1C, which is kind of the average blood sugar over 3 months. And what you can really provide a value proposition, again, to both the employee and the employer, to where they have insight into screenings that they may not have gone otherwise to the doctor, especially during this past year. But it also provides a lot of value to the employer who's going to be providing that healthcare insurance in one manner or another. And then the final win is actually for the country, because what we've seen from a population health perspective is that with regard to obesity, about 40% of adult Americans are obese now. And the CDC states that that's a very risky proposition for the nation. One, because there's so many correlated medical conditions such as heart disease, stroke, diabetes, some cancers. And so it's really going to improve the health of the individual if they get that proper screening. We've heard of high blood pressure as the silent killer, because you don't have symptoms until you have a lot of disease or symptoms that have gone unnoticed for many years. And so when you see the obesity rates really just getting higher and higher. And then also with diabetes, we have about 10% of the adults in the country. And so that's about 30 million people. And so you have 84 million adults in the country diagnosed with obesity, and about 34 million with diabetes. And so those are really serious medical conditions that if aren't detected early enough and are not addressed appropriately, can really affect, again, the individual's life, as well as the company's human capital planning with regard to health insurance spend, but also just having people being able to do the work. COVID, with those vulnerable populations, a lot of those conditions that obesity, diabetes, place those persons at much higher risk for severe disease, which is the whole reason the world has been focusing on COVID, was the risk of hospitalization and death. And so, again, having these at-home, very patient-centered, easy access, simple testing protocols that include laboratory, but also blood pressure, weight, and abdominal girth screening can provide a lot of value.
That's great. I think I want to talk a little bit about, we've talked a lot about at-home diagnostics, and I think one of the things that we've talked about is many traditional doctor practices have moved primarily to virtual care, and they're seeing the same, sort of lack of compliance that we see. Whereas a patient at home who's been at home, or you're treating at home, the probability of them going and getting a test at home or a test in a facility when they've been at home is much lower than when they traditionally would be recommended a test by a doctor, and maybe the test was down the hall or on the way to the car in an adjacent building. And so, we've seen traditional practices start to increase the amount of at-home testing that they're doing, because they're not getting the patients in for the more high complexity testing that they need to do, that would feed off of, let's say someone has an A1C of 10, or it has a really high A1C. When they can't even get the baseline values, it's really hard to figure out what the follow-up care is. And so one traditional avenue is to get them in. The other thing that we're seeing is more and more traditional practices are engaging at-home testing as a way to engage patients and reach patients and increase compliance, so that they can get them in, right? So they can get some baseline understanding of what to treat, where patients have started to sort of think about skipping the doctor's office altogether, or not coming and seeing the doctor in person where they can do a blood draw. And so with hundreds of biomarkers available through at-home testing, this is a viable alternative for some of the baseline data. We also see self-insured employers. They've traditionally been interested in biometrics, but as self-insured employers, they're the insurance company, and they're starting to look at a much broader range of testing that includes all kinds of preventative testing, including like colorectal cancer screening, has become much more common, where employers see the numbers really low and they want to implement solutions, and they're taking control of that. Often they've used their ASO providers, their administrative service agencies, the health plans, to help them with some of that. But now we see employers stepping much more heavily into preventative screening. One of our clients even asked, they're like, I heard a lot of people have been drinking more during COVID. Do you guys have a liver test that I can use? We haven't implemented that one yet, but I think people are thinking about the long-term consequences of what's happened during COVID. I mean, childhood obesity rates have increased dramatically in 1 year, especially in children under 10. And we're going to deal with the long-term consequences of this, no matter what we do. We've talked a lot about the barriers to preventative testing already, and in particular, Kimberly mentioned a lot in that population. We've done a bunch of research, and a McKinsey report showed that 64% of people either indicate cost or time-related challenges getting time off work stop them from getting testing, going to the doctor, being healthier. So I'm going to skip to an interesting question that I think I would like to ask the panelists before we go to questions from the audience. And for the audience, you can type questions into the chat on the right. There should be a chat box that has yellow thought bubbles or text bubbles where you can type your questions, and we'd love to get questions from you, and we'll answer those in a few minutes. But I'm interested in, virtual care was crucial during the pandemic. Kimberly, how do you foresee people reverting? Are they going to just go back to everything's to be the way it was before the pandemic? Because the vaccines seem to be effective and cases are dropping dramatically. Or is it going to be, this is the new normal? Virtual care is going to be adopted at scale even more. What are your thoughts?
Yeah, I don't think we're going back. I think this is the way of the future, particularly with the population with which I deal. And you and Scott both mentioned the dynamic of employers now getting more savvy to the fact that if they have a healthy population, their medical costs go down. If they're not an employer that offers health benefits, there are tremendous rewards for offering things like diagnostics, like virtual health, telehealth. People are more the lack of reduced presenteeism, reduced absenteeism, reduced turnover, all those things that erode the profit margin of hospitality businesses. Those that do offer medical benefits, whether they're fully insured or ASO, they're now becoming savvy. I know I'm doing a lot of training with hospitality businesses to help them understand that if they're self-funded, of course, they want to eliminate claims, and they want people to become healthier, and this is the way to do that. If they're fully insured, same thing. They're going to reduce their costs over time with lower claims, with healthier people who are more. So I see employers really, really incentivizing employees to get well and stay well, giving them more access to virtual things like telehealth and things like at-home testing. The affordable access, giving people what they want when they want it on their own time. People now know they don't have to go sit in a crowded ER with their sick toddler all night. They know they don't have to do that anymore. So they're not going back to that. I don't believe. When you look at let's get checked as the diagnosis is number one to start off the health journey. And then you go to telehealth. And I always like to quote Jason Gorvick from Teledoc, who says, telehealth is the great equalizer in healthcare. And I totally believe that. There's no socioeconomic disparity. There's no anything. You don't need a car. You don't need a babysitter. You don't need anything. You can get telehealth. You can get convenient testing and telehealth, virtually. And I don't think people are going back. I think people are realizing that access is, if you look at, let's say, mental health, and you see that it's taking people now up to 3, 4, 5 months to get in to see a psychiatrist in person, a new patient visit. Well, on Teledoc, for example, it takes you 10 days. and they have psychiatrists in every state versus, out in the physical world, there isn't a psychiatrist in every county in this country. So I think the access, I think people are accustomed to it now. I think it was all kind of a weird subculture almost before, of like, who would get a test through the mail? Who would do that? And do we trust it? That's just weird. I think people are now understanding that it's valuable, accessible, avoiding crowds, it's safer, and it's the accuracy is there. And I don't think we're going back.
What do you think, Scott?
Yeah, I agree. The practice of medicine is slow to change. And so I've seen pieces of telemedicine slowly kind of grow and grow. I think the earliest I've seen was kind of dermatology consults where, you would still go to a fixed facility, but then you would get pictures taken and sent to a dermatologist for a consult. And now I've seen it slowly get more and more embraced, but COVID really has accelerated that. We saw a lot of the state medical boards relax their rules with regard to practicing across state lines, because for the most part, you still need to be licensed in each state that you see. And so it's still helpful to help out. Like if I'm licensed in Texas, Virginia, North Carolina, I can take care of people there. But it'd be nice if there wasn't so many constraints. And so COVID really relaxed those standards temporarily. Alternately, too, consumers, right? So our patients are consumers of medicine, and so they're going to look for the most the approach that fits them the best, right? And so we've seen how retail has dramatically changed in the last few years of ordering online, delivery to home, and so I want to be part of that. I want Axiom to be part of this patient-centered. And I don't even want to say it's convenient. It's what we really owe our patients, right? To make sure that they have as few obstacles to care as possible. So I do think this is to stay.
Yeah, I always tell my friends we're the last generation of people, my age who are going to think about going to the doctor on the corner of 2nd and Main and Sweet to get something, because dermatology is a great example. There's been dermatology like psychiatry. It's like the wait times are enormous for new patients, right? 6 weeks, 8 weeks, depending on the market you're in, can be 3 months. And really, it's like, I need to look at it. I'm making one decision, which has basically 3 outcomes. Wait, right? Just let it sit for a few days. Get a prescription, which both can be done virtually, or I need to do some type of a biopsy, right? So there's kind of really 3 primary outcomes in dermatology. And with the quality of the cameras that we have now, like you can do that first screening visit, no problem with a virtual dermatology visit. And I think we see, obviously our mission is to increase at-home testing, but we need, I think consumers and access is a huge deal, right? And just access anywhere, anytime is important, and our on-demand lives demand it, right? We not only is it, if I can have the convenience of talking to a doctor from sitting in front of my computer versus having to find childcare and going on a bus or a car for 20 minutes and waiting in a waiting room after I've scheduled the appointment, which took me 6 to 10 weeks to get, I have to wait an hour in the waiting room. And that's just 7 to 10 minutes with the doctor. That's just a big struggle. I think there's a couple of questions. What is your advice to providers to encourage hesitant patients to do at-home tests? So what kind of advice would you give people if they're hesitant to do at-home tests? I think, Kimberly, you mentioned the quality, like we're a CLIA certified lab, same as any other. The test is an at-home collection that gets to our lab. Same FDA regulations and oversight, very high quality results. We benchmark those results against the best results in other laboratories before we publish those, before we establish those home kits as regulatorily within the guidelines. And so sort of what do you think, what advice would you give to providers to encourage them to use at-home testing?
Did you want me or Kimberly, Derek? I didn't catch that.
I think, Scott, why don't you answer this one first, and then Kimberly can follow up.
Yeah, I would actually echo what you've said and just maybe add a little more detail. So for the majority of clinical practices, really aside from the front end look of a clinic versus at home, once that sample is taken in a clinic, really the same thing happens whether you're at a clinic or if you're at home. It's going to be logistically shipped to a larger laboratory to be tested. And so there are quality controls, there's FDA approvals for these tests. So really that meets the standard of care. In fact, I think sometimes people worry that their sample may be not adequate. And so there are controls for that too, but that happens in the hospital even. I've seen it to where blood draws come back as indeterminate because there was some kind of mishandling of the sample or the blood cells were lysed, things like that. So you're going to come across a small percentage of potentially rejected samples, but really the efficiency is really going to outweigh those small side effects. And that happens again in the clinic, in fixed facilities and hospitals. And so really, there's really not a downside to doing home testing.
Yeah, we've been able to improve those dramatically. We obviously track very closely all the kinds of things that come in, and with improvements in the technology on the laboratory side and improvements that we've innovated and other companies have innovated on the collection side, we can collect very small vials of wet blood and do many of the tests that can be done in a hospital laboratory and via home collection. Not all of them, and not all of the diagnostics can be done in the home. And I think it's important. Doctors, some of the more sophisticated labor-intensive diagnostics still need someone to come into the hospital to take care of them. But most of the baseline stuff can be done virtually through at-home sample collection.
I think it's critically important, I think, for population health that people start understanding the value of home testing and through trusted advisors, whether they're providers or people in the hospital. But then you've got to look at the whole segment of people like hospitality who aren't going to doctors and they're not in front of. So then you look to who else, who do they trust, what organizations? And so you go to their employers. You've got to train the employers that this is in their best interest and their employees' best interest to have these tests.
Have you seen, let's just go to broader testing, I think. Have you seen in your employer populations a worry that
you just got to look to who train to get engagement?
Okay. Sorry, I might have interrupted you, Kimberly. Didn't mean to. I'm curious as to just beyond at-home testing, is there a perception among the employers and folks and health plans and other organizations that you work with that increasing access to testing will increase cost? Because I think there's a common misconception that improving access to testing will lead to increased, medical utilization down the road.
Is that cost by identifying conditions and additional more costs down the road because of the diagnosis?
Yeah.
Yeah, I have not heard that feedback, but that's a great point, and I think I will make it a point to mitigate that as I'm out there training hospitality employers and making sure to address that question if they have it, because ultimately, clearly, if the person has a condition, the person is going to worsen, and without a diagnosis and without treatment, it's a lose-lose for everyone. So, but that's an interesting thought.
I don't know if you have any thoughts about that, Scott.
I do actually. Obviously, there's been a trend in either concierge medicine or direct primary care where it's a different business model, and it's really kind of between the patient and the doctor. There's this direct relationship, so you don't have an insurer. And what I've seen happen in the last couple of years is that it allows the doctor to be more accessible for their patients. So they might have a smaller patient pool. But I think that was the biggest concern from a lot of the docs that went forward with this model was if my patients have my cell phone and have unlimited access based on a membership fee, are they going to call me day and night? And I think what's actually panned out from kind of the experience is that one, they're able to take care of their patients holistically. And so once they get to know them and deal with their issues, they actually are, there's less need for interaction. And so it's quite interesting. Or if something starts, there's that classic, an ounce of prevention beats a pound, a pound of cure. But if you can get things at the early state, it's actually much less costly for whoever's paying for the cost. But I think in general, this direct primary care model has really been beneficial for both the patient with great access, but the doctor's practice is actually quite manageable. And so I think you have a natural experiment there that access does not increase cost,
Yeah, I think it's been, one of the concerns of the payers for sure has been, unnecessary utilization and diagnostics in certain disease categories has played a role in, driving up utilization. Once a diagnostic category becomes available, there's a whole bunch of care that follows on that was not possible before. And so I think new diagnostic categories often increase costs and increase the type of care that people are getting, often very appropriately, right? There was no diagnostic for it before. Now there is a diagnostic and there are treatments. And so diagnostic treatments often are sort of developed and approved, obviously, at the same time. And what we have and what we've seen is, increasing access to preventative care and increasing access to preventative testing and the type of testing that people need to have at scale for diabetes and heart disease and colorectal cancer screening and other types of screening and infectious disease screening actually lowers costs. It doesn't increase cost at all. So, and that's what we've seen in our world. And I think people get confused between a new diagnostics or cancer detection methodology and the invasive procedures or other things that might be associated with that versus increasing access to preventative testing, which I think everybody's been very supportive of and is generally very supportive of. I'm looking at questions from the audience, and we don't have any more questions from the audience. And I think we've covered this topic adequately, and I hope the audience has appreciated and benefited from our conversation. I'll wait 30 more seconds for any other questions to come in. Again, you can type them into the chat channel on the right of the console that you're in. If not, I'd like to thank Kimberly and Scott for joining me here. I'd like to thank our audience for taking the time to listen to us and to learn more about this important topic. Thank you so much. Have a great day.